Cactus 15.9, your departure to contact line, maintain 15,000.
Day 1 to 5,000, Cactus 1549.
After a series of avoidable crashes in the 1970s and 80s, commercial airlines finally got serious about passenger safety.
0.9, turn left lane 270.
This is Cactus 1539.
The airline industry developed a revolutionary new system of job training and information sharing called crew resource management. Pilots, flight attendants, and ground crews were all trained to share information and better collaborate on the job to dramatically reduce the risk of human error and radically increase the level of safety in this high-risk industry.
Can't do it.
Okay, which runway would you like at Teterboro?
We're going to be in Hudson.
I'm sorry, say again, Cactus?
210, 4718. I don't know, I think he said he was going in the Hudson.
Lives were saved due to the combination of a very experienced, well-trained crew, all of whom acted in a remarkable display of teamwork, along with expert air traffic controllers, the orderly cooperation of our cool-headed passengers, and the quick and determined actions of the professional and volunteer first responders in New York City.
After 30 years of CRM training, air travel is now the safest it's ever been.
In the last 30 years, the airline accident rate has decreased at least tenfold.
How safe and reliable are other industries, like healthcare, where saving lives also requires teamwork and communication?
Devastating result. Something that I have to live with for the rest of my life is the lack of communication, or the lack of really clear and effective communication between care settings, care practices, and between those providers and my dad and myself. So I don't think there's a component of healthcare that's more critical than clear, concise, effective communication.
Crew resource management is a wonderful tool to standardize communication between team members, especially in non-normal situations. My name is Bill Schuler. I'm a retired orthopedic surgeon, and I am the Director of Training for Safer Healthcare. Communication is something that we all feel very comfortable with. We spend our days communicating with each other. But when we are on a team in a critical situation, our communication can be a real distraction. If there's too many words, if we're talking about extraneous things that are going on. So it is a very vital skill for us to learn to communicate in critical situations with a minimum of words that are well thought out and very concise and pointed. Crew resource management is a process for creating standard communication between team members, especially in a non-normal situation. The idea of standardizing the language is not to try to structure every communication that team members may have while they're working together, but it is for that critical situation, the non-normal situation, when we need to say something quickly that the whole team will understand, and it carries a lot more meaning than just the few words. So what we are talking about is some critical language, and we give examples of that in our training, but we encourage teams to create their own critical language that makes good sense to them, so that if I see the team or an individual on the team about to do something that I think will really negatively affect the outcome, that I can say one or two words that the whole team will immediately understand and respond to.
TeamSteps is our innovative approach to implementing and sustaining healthcare safety throughout our organization. I believe TeamSteps will allow civil and military medicine to work together to enhance safety in healthcare systems around the world.
Communication failures and lack of teamwork are major contributing factors to patient injury and harm. And a growing body of evidence from the military, corporate settings, the transportation industry, and healthcare settings confirms the fact that essential team skills can be developed.
Teamwork training is a change in culture.
The use of concrete teamwork fundamentals can improve the efficiency of care, delivery, and outcomes for our patients.
Team performance and effective communication are the foundations of the TeamSteps learning system. We are all part of a multi-team system. Each team member is empowered to speak up when situational clarity is desired. Using the CUS technique provides another framework for conflict resolution, advocacy, and mutual support. Signal words such as danger, warning, and caution are common in the medical arena. They catch the reader's attention. CUS and several other signal phrases have a similar effect in verbal communication. When they are spoken, all team members will understand clearly not only the issue, but also the magnitude of the issue. First, state your concern. Then state why you are uncomfortable. If the conflict is not resolved, state that there is a safety issue. Discuss it in a way that the concern is related to safety. If the safety issue is not acknowledged, a supervisor should be notified.
Lucinda, I'm going to need you to step in while I get Dr. Smith. Eddie's complaining of new onset chest pain. His BP is 90/65, heart rate 110. He looks pale and diaphoretic. Peg's getting his 12 lead. He has his oxygen. He's having an MI. Get him on a monitor, start an IV. I'll be back with Dr. Smith in 2 minutes.
Oh no, poor Eddie. Has he had anything for pain?
No, that's something you can work on. Dr. Smith, I have Eddie Thomas in room 6.
Hold on.
Eddie Thomas, 56-year-old with congestive heart failure, multiple ED visits.
Yeah, I'll tell you what, 40 milligrams of Lasix IV, O2. I'll see him as soon as I'm done with these dispos. Got to clear some rooms or we're going to be back on the verge.
Dr.
So
Smith,
listen,
I'm concerned.
All right, look, I'll have to call you back. Okay. Yeah.
Eddie isn't presenting with his usual heart failure. He has substernal chest tightness radiating to the jaw. He looks pale and diaphoretic. BP is 90/65, verified with manual cuff, pulse 110. We've got him on O2. We're getting a 12 lead starting a line. I think he may be having an MI. We need you to see him now.
Based on what you said, sounds like it might be an MI. All right, I'm on my way. What would you say, room 8?
Room 6.
Okay, room 6. Got it.
Right.
Hi, Janet. How are things looking tonight?
Hi, Dana. I am late to pick up my kids at the sitter, so I need to make this quick. We have a 27-year-old prima gravida who's had an uneventful pregnancy. She has been admitted at 41 weeks for induction with an unfavorable cervix. Poor thing has been waiting for a bed since early this afternoon and just got admitted.
That long, huh? Well, how's she doing and who's the attending?
She's stable right now. The attending is Dr. Upton.
We're doing a stat section in room 15. I need your help moving the patient to OR.
Right, I'll be right over. So nothing but the usual, right?
Right. Sorry, I'm in a rush.
Okay. Dr. Dean, I'm concerned about Ms. Keys. I'm uncomfortable watching these late decelerations, the baby's heart rate's in the 60s. I mean, I just don't think it's safe to continue labor.
We need to do a crash section. Get Upton in here.
Great job, everyone. Can we discuss how things went today with Mrs. Keys? What did we do well, and what can we do better next time?
It was helpful for me to be brought in early. That allowed me to use a regional instead of a general anesthesia.
You're right, Grant. Lynn, what did you think?
It was great that Dr. Dean helped put the Foley in place while I did the count with Alicia.
Albert, this is a great example of task assistance. How was our communication today?
Excellent.
Crew resource management was a program that gave you a process and a language, and everyone knew that everyone knew the language. So if I said to you, Captain, I'm not comfortable with this, he had to hear that because it was done in a process in a way that we were all trained. It just meant that if you spoke up, they were going to listen. And it also meant you had a responsibility to speak up.
At first, they did not buy into it. I would say the majority of my colleagues in the 1980s thought this was just another fashion trend.
They refer to it as charm school.
The old way that healthcare was organized, with the doctor up here and everybody else down here, really created terribly unsafe conditions.
They come in, they see the patient, they do possibly order entry, and then they're off the floor before the bedside nurse even knows that they've come and gone.
All of the errors and miscommunication were just catastrophic in the way they affected my daughter.
So what does it mean to go beyond the checklist?
The aviation safety movement is not one thing like a checklist. You know, that's why we call the book Beyond the Checklist, because it's about leadership, it's about followership, it's about anticipating threats and working together to figure out what you're going to do. It's about soliciting input. It's about encouraging people to speak up and supporting them when they do speak up. It's about teamwork training and communication training, and that's what needs to be done in healthcare.
Simple fixes like using a checklist or doing a double check, those help, but if you don't change the culture, if you don't change the nature of people's work, how doctors and nurses communicate with each other, how we train young residents and medical students, then you can't really, you can make some progress, but you can't completely fix this problem.
CRM can benefit the medical industry the same way it did the airline industry, in that lives are at stake in both industries.
First of all, there's too many patients getting harmed and there's too many gaps in communication. I can't wait for the system to change.
The problem is we don't have a lot of time because patients are dying every day. And patient advocates I work with, wonder, where is the outrage? How many more people are going to die before we're going to really change the system?